Welcome to a special edition of Medicine of Meadville. I'm Dwayne Kohler, and I'm joined by Danielle Baslak-Fettig.
Yes.
So, since we're talking, that must mean something. What does that mean?
We have some new physicians.
Oh.
Yes, we have
Okay.
Dr. Victor Pilewski. He's a new general surgeon. And we have Dr. Pat Cole, an internal medicine physician.
Okay, so one of my favorite things that we do on Medicine of Meadville is let folks get to meet our new doctors.
Yes.
So, well, let's get to that.
Here at Meadville Medical Center, we are always welcoming new physicians, and we are very pleased today to introduce you all to our newest physician to Meadville Medical Center. This is Dr. Victor Pilewski, our new general surgeon. Thanks for being here today.
Thanks for having me.
So tell us about you. I think the first thing everyone has asked is, oh, is he a local guy? The name is familiar. And indeed, you are a local guy.
Yes, that's correct. I'm from Oil City, originally, born and raised there. Went to Allegheny College for my undergraduate training.
Mm-hmm.
If the name's familiar, it's not my father, but my father's cousin was an internist in Oil City for many years.
Okay.
After going to Allegheny, I went to Penn State Medical Center for my training in Hershey, PA. And then after 4 years there, did my 5 years of general surgery training at University of Kentucky in Lexington.
Okay. So it was really cool. So as the recruiter, we put ads out all the time and we have people call. And so you called and you said, hey, I went to Allegheny College. I'm a local person. And that, as a recruiter, makes us very excited because someone local knows about the area and is just a great fit. So tell us about your interest in Meadville and why you decided to move up this way.
Well, I am a northwestern Pennsylvania boy, born and raised. I've always kind of wanted to come back to the area, was just waiting for the right opportunity. First thing everyone asks me when I'm coming back is, or before they know that I'm coming back, is, have you heard about the winters yet? So yeah, I've already passed that test, so that won't scare me away too much. Looking forward to some snow. But I just wanted the opportunity to come back home. I have 4 brothers and sisters that are still in the area, 2 in Oil City, 1 in Erie, Pennsylvania, and 1 in Gibsonia. So I want to come back and be closer to them.
That's great.
It was a great opportunity to come back to where I spent 4 years of college.
Yeah.
Enjoyed it.
And you were in Moorhead down in Kentucky for how many years? Tell us a little bit about after training where you practiced, your experience there.
After I finished my general surgery training, I went into practice in a town called Moorhead, Kentucky. It's halfway between halfway between Lexington and Huntington, West Virginia. It's a decent-sized hospital in a rural area down there. I was in practice with 5 other general surgeons. Very collegial work environment. We trained residents there as well, and saw a very wide range of general surgery. We, treated breast cancer, colon cancer, hernia procedures, pediatric emergencies, things that came up along the way, and referred out what we couldn't. So I
had some good experiences.
Had some great experiences there. Got some good tutelage from my colleagues early on there, and got to establish myself.
So you're used to a small town, smaller hospital.
Yes. I'm very comfortable with that atmosphere.
Great.
And one of the reasons I came back here.
So why general surgery? When you go through medical school, you get to try out, and with your internship and residency, you try out different things, but why in the end did you decide general surgery?
Well, I really felt general surgery was somewhat of an unlimited field. Oftentimes, when other physicians aren't sure what to necessarily do with the patient or need another opinion, we're kind of one of the first lines surgically to talk to, get another opinion on. So we treat a wide range of diseases, and
So our hospitalists, so you could get referred to general surgery a lot of different ways, from your family medicine, your internist, our hospitalist program. What kind of surgeries do you do? So we have, all these referring physicians that will refer to you. What kind of surgeries do you do? What do you do most of? And then just kind of give us a brief overview of the
Sure.
procedures you might do.
I think general surgeons, as a whole, typically we're going to spend most of our time dealing with gallbladder disease and hernia repair.
Okay.
I have a personal interest in hernia repair myself.
Okay.
I've gone to a few different conferences and have, in my previous practice, been the practitioner that gets sent kind of the more complex hernia repairs, and that's something I really enjoy doing.
Mm-hmm.
We deal with the surgical management of breast cancer, the screening, as well as once a diagnosis has already been made,
Okay.
and follow up for that, colon cancer, discussing colonoscopy and screening for cancers, as well as their surgical treatment and follow up.
Okay. I mean, it's a great hospital to be at because you get to know, it's a smaller community, so you get to know your referring physicians. And I think that's probably what appeals to physicians coming to smaller towns, that you get to know the other physicians and you work together, and it really is a collaborative effort to help the patient. It's not once we pass them along to the surgeon, you don't see your family medicine physician anymore.
Right, and that's been my experience so far, although I haven't been working here long yet, just at different meet and greet events, the other physicians, very collaborative effort to, take care of the patient. It's not, just a cog in the machine. Everyone works together, and it's been very approachable, and I've certainly liked those interactions I've had so far.
So what are you looking forward to most? At this point, you've just moved here, you're getting your house ready, you're getting all the paperwork. Once you're starting, what kind of things are you looking forward to most, I guess, overall, about working at the hospital and living in Meadville?
I think making connections with the community, again, as a whole. I really enjoyed my experiences when I was at Allegheny College, doing things with Make a Difference Day and
Mm-hmm.
different outreach events, being involved as a part of a community. The location that I was previously, it was a little bit more rural of an area and wasn't as a strong community as I see Meadville being, and from how I remember.
Mm-hmm.
So just kind of taking part in all those things.
Yeah, it's wonderful to have Allegheny College in town, and you having gone to school there. We have a lot of Gators joining Meadville Medical Center, which is a cool thing.
Yeah.
And you guys have dogs, and so we had talked about, I think you came to town, Ainsworth is here, that had to help in your decision making.
Oh, of course. We just bought our bag of dad's dog food the other day when we were coming back from the Bark Park. Picked up our 96-pound German Shepherd.
Oh my gosh. So you're fitting in right away.
Yeah.
And you might like to do some hunting. It seems like Meadville's the perfect place for you guys.
Yeah. The chance to come back home, I miss, boating on the Allegheny River, going to Lake Wilhelm. We've already gone up to Presque Isle just to walk around and look at the, shoreline, the hunting, fishing, all that.
It's such a beautiful area. It's funny how, because I'm from here and went away for a while, and this place just pulls you back in.
It has for me, yeah, certainly.
So let's get your phone number. It's Liberty Street Surgical Associates. So you're located in the Liberty Street Meadville Medical Center Medical Arts Building. That's where you'll be doing the outpatient work, and then of course the OR is at Liberty Street.
Okay.
And your phone number 814-373-3434, so people can call and get appointments, and family physicians will be referring to you. Anything else you want to say to all those viewers out there?
I like to think I'm a very approachable person. If you have any questions or concerns, don't hesitate to give me a call, stop me in the street or the grocery store, say hi. I'm glad to be here and help you any way I can.
Sounds good. Well, thanks so much for being with us today.
Thank you.
And now for a health tip.
Hi, I'm Jamie Ferry, and I'm the Prevention Supervisor at Crawford County Drug and Alcohol, and I have your health tip. I'd like to talk to you a little bit about your prescription medications. A lot of people don't realize what all goes into being considered when a prescription medication is prescribed for you. And because of the variety of factors that are taken into consideration, you want to make sure that you utilize that medication and only you use that medication. And you want to use it appropriately. So you need to follow the directions on the bottle as it is prescribed. If it says that you're supposed to take one every 6 hours, then you take one every 6 hours. If that medication is not working for you and you feel like you need a stronger medication, then you need to talk to your physician about it and not change that prescription for yourself. Be aware that medications can have a lot of different side effects, and you're going to want to read your materials from the pharmacy when you pick up your medication, and you're going to want to check your medication before you leave the pharmacy to make sure that you have the medication that you're supposed to have, that it's the right dosage, and that it says the correct instructions that you understand you were supposed to have from your physician when you originally received it. You don't want to share your prescription medications. You may not be aware of a medical condition that someone else has that would affect them if they took the medication that you're on. If you believe that this is a medication that treats whatever the symptoms are well, you can certainly advise people that it's been successful for you, but they need to go through their physician in order to receive that medication. And you never just flush medications down the toilet or wash them down the sink. There are many ways that we can dispose of medications now, including prescription drop boxes and take-back events. If you are not sure how to dispose of it, talk to your local pharmacy, or we would be happy at the Drug and Alcohol Office to advise you on how to do that. So thank you for listening, and that was your health tip for today.
Well, thanks for the health tip. We appreciate those. Joining us now, Dr. Pat Cole. Dr. Cole, welcome to Medicine in Meadville. And so tell us about you. Tell us about where you're from originally and how you made your way to Meadville.
I'm originally from West Texas, Odessa, which is, if you ever heard of the movie Friday Night Lights and all that.
Sure, yeah.
I played for football for that team.
Okay, how about that? That's probably why they started the show.
Yeah, of course.
It has to be.
Yes, of course. Anyway, I went to medical school in Galveston from Odessa. We transferred to Galveston, lived there many years, and then I worked for the VA after that, and I moved to Central Texas, and that's where I've been until now.
So Texas, Pennsylvania, Michigan are the three states in the country that have the most hunters. And so which also means probably a lot of rural stuff, a lot of outdoor activities, a lot of interest. So Texas and Pennsylvania are different, but not really that different. I don't think.
No, not too different. Both are big football countries.
Football's very popular around here, and other sports too. Hockey. Hockey's just getting off the ground. I'm not sure how that is in Texas, but
well, we have a hocky team in Odessa.
Okay.
Semi-professional team.
So
the Jackalopes.
One thing that probably is different is I imagine we have more snow here. Did anyone ever tell you about that?
What is that?
What is that? Well, okay. Well, never mind. Okay.
I heard
never
stuff falls out of the sky and makes you feel good. So.
That actually will happen pretty soon. That'll happen pretty soon. So we could, in the past, we could always kind of count on snow from Christmas time to like the end of February, something into March. And the last few years it's been wacky. It's like February, January, February, there's no snow last year, but it snowed like crazy in December and it snowed like crazy in March and April, but who knows?
As we're driving here, we saw the leaves on the ground. I'm like, wow, if leaves fall off the trees and stuff here.
Well, one thing I think that you'll enjoy is that kind of more rural nature here of Northwest Pennsylvania. It's
all the people
country
from Meadville Medical Center and Northwest Physician, everybody, the whole community has just been incredible. The totally opposite of what you hear down in Texas. Let's say the people up north are a little snotty, but no, No, they've been. I swear everybody here is from Texas.
See, now people around here. They start that so that not too many people flood in and sort of take over. They want to keep.
That's the secret.
Yeah, that's got to be it. Okay, so internal medicine is your specialty. So tell us about what that all entails.
Internal medicine is general primary care for adults. It's where. Oh my gosh, I'm brain farting. Anyway, we take care of anybody that's 18 and over, any type of serious disease like diabetes, cancer, stuff like that.
So in an area like Northwest Pennsylvania, we have a fair number, probably more than a fair number, percentage-wise, of senior citizens that are part of our population. A lot of folks age in place and they want to stay. So the kind of things that you deal with are going to be more of the things that are going to affect a more senior population. Is that right?
Exactly. That's correct. That's correct.
I know. I'm on the board at the free clinic, which actually just moved here. We're going to talk about that for a future episode for Medicine Meadville. Just moved upstairs here. One of the issues that folks without insurance for many years, diabetes and cholesterol issues and
heart disease
and those kind of things. Those are big deals.
They're very big deals.
Let me ask you to make a sales pitch. Okay, so who's your doctor? Oh, whoever's on call at the ER, whoever's on call at the urgent care. To me, that's a mistake. So let me ask you to make that sales pitch.
I agree. I think you should follow the same patient throughout the years. I mean, the patient, you can walk into the room and not have to look at their chart. You just see their face and know immediately what to do.
When you have a chronic ailment, you need to have, to me, you need to have the captain of the ship. So maybe you need to go to a specialist here, maybe you need to go to a therapist over there or whatever, but you need to have somebody, again, this is a question. What do you think?
You're absolutely correct. In Texas, we call it, everybody needs a quarterback. And so, yes, the primary care serves that purpose.
So when you get to, okay, I'm not feeling well, upset stomach, and I've got this or that pain or whatever, let me ask you to make another judgment call here thing that I think people, I hear about it anyways from time to time. When do I call my doctor? When do I go to urgent care? When do I go to the ER? Make the three choices here. Help people, with your opinion about that.
Well, I don't really recommend urgent care myself. I would say either your doctor or emergency room. Emergency is obvious, chest pain, something that needs immediate attention. But to maintain your medications, any type of illness that's not an immediate or emergency, I would recommend seeing your doctor.
One of the things that, to me, we want to keep people out of the emergency room unless they really are having that chest pain or severe abdominal pain or one of those kind of things, right?
That's correct. That's correct. But don't second guess. If you have to make a decision, well, do I see my doctor or do I go to the emergency room? I would fall short and go straight to the emergency room.
I know for a number of years, one of the main reasons why people went to the emergency room here was for a toothache, and it's like that. It's so efforts are underway to have other ways to deal with that and so on. To me, the side effect or the negative effect of that is dealing with pain, and for many years it's like, well, we need to give you a pill, and and now we're seeing overdose deaths all the time, and that that's like, you need to have a doctor involved. You not need to be running to 19 different people all the time. You need to be having that quarterback, right? Like
exactly.
that you mentioned.
And the way the medical records are and technology, we can actually follow if a patient goes to another doctor. We immediately have those records and everything.
That's one of the things that so Obamacare required, but our hospital had done for many years prior to that, was a needs assessment of the community's health, and it's now a requirement, so we just kind of kept doing what we were already doing. I think that's going to be the issue for next time is how to turn this sort of crisis, back around. It's gotten all convoluted,
it's kind of
all over the place.
Nearly out of control, but I think we're gaining that control back right now.
What do you think about the use of medications for pain, like as the only thing?
Well, it's an interesting question. Back in Texas, they would consult me a lot. Another definition of an internal medicine doctor is somebody that knows their medicines as well as a surgeon knows his tools. And they'd consult me a lot, and I would take away more medications than I would ever give most of the time. So
I think I may have told the story before on our show, but what my grandmother, and she's since passed away many years ago, but she had been with multiple doctors and ended up with a new internal medicine doctor who was fairly new and out of school and whatever. And he says, wait a minute, we're stopping all these medicines and we'll see what ailments come up. She was like 19 pills she took every day or something.
oh my goodness,
And so he settled it down on the 5 pills. And so for her last number of years of her life, she was much more comfortable and wasn't taking pill after pill after pill for the side effects of the other pill.
That's usually the case, yes. When you start having to do the side effects for the other pill, you just run into a game that never ends.
Back to the quarterback thing. That's why you need one. That's why you need one person that's kind of in the center of the whole thing.
Right.
Well, how does somebody find you if they're in need of a new doctor? You're available. How do they find you?
I'm at Northwest Physicians Association over on Water Street, and you can look me up and find the number for Northwest and make an appointment.
Good. Well, Dr. Cole, it's great to meet you.
It's a pleasure to be here.
Welcome to meet you. We're glad to have some Texas folks coming.
I'd like to bring a little Texas to Pennsylvania, and let's see what happens.
Very good. Right. Well, thanks.
All right.
Well, thanks for our new doctors for joining us today, and thanks Danielle for helping set this up so we can talk. And so what's coming down the road? What else is going on here?
Well, we just had the Follies, and so
is there a little recovery time after that?
I'm thinking,
which end is up now for a while?
Weeks and weeks of Follies, huge crowds, made a lot of money. We'll be telling all of that, but really just a wonderful thing to see how the community comes together, both on the stage, all the advertisers that we had.